pelvis. Good. So with femur, I just showed you how to palpate femur. What other things can you palpate on the femur? Especially on the lateral side. What's that bump on the lateral side that we talked about? Greater trochanter. Good. So you can find that. Oftentimes it's easier. Hers is pretty easy to find. Depending on how much tissue they have, it's oftentimes easier to get them lying on their stomach. I can show you that when I flip her over. And then you can rotate the femur back and forth, and then you can feel it sort of popping out under your fingers. But greater trochanter is basically on the lateral side. What else do we palpate? Not necessarily in the femur, but in the hip. Iliac crest. Good. So remember, find her waist and just kind of work your way down until you feel bony parts. So that's her iliac crest. You can feel the whole entire thing. Make sure everything's stable, no tenderness. What else? ASIS. ASIS, good. So again, you can follow that iliac crest to the ASIS. And then you can even go lower, try to find the AIIS. It is deep and hard to palpate. Hers would be like right about here, I think. But there's lots of muscles that pass over it. So definitely find the ASIS. Good. Let's flip you over. What's on the back side? PSIS. Good. And what else?
Ischial tuberosity.
Ischial tuberosity. Good. So to find the PSIS, again, I'll find the iliac crest, work my way down. 2 bones right there. PSIS on either side. Ischial tuberosity. Remember, you have to go up in the glutes. And it's usually a lot more medial than most people think, but that's basically your sit bones. So you can palpate that. Anything else? You can do like the spinous processes of her lumbar spine. And you can palpate her sacrum. So basically, if you keep following the lumbar spine, it also becomes her sacrum, so S1 to S4, 5. Or you can kind of, if you find where her PSIS is, you know it's just medial to that. It's kind of like that. That would be her sacrum. All in here. Okay. Anything else? Okay, what would you do for articular then in the hip? Any ideas?
SI joint.
SI joint, good. That's basically all we really do. Hip joint, remember all, like the hip the joint and the ligaments and the capsule are really deep, so they're difficult to palpate, but you can easily do the SI joint. So again, for that you have to find the PSIS, and it's just directly medial from the PSIS. Okay, and it runs vertical like this. That's your SI joint. And that's basically all we have for articular in hip. So muscles. What do we have? Piriformis, good. So one of those deep rotator muscles. What else? Glute max, good. What else? Hamstrings, good. Especially the more proximal part, so I showed you that already. What else? Iliopsoas, good. Anything else?
Adductor longus brevis.
Good, the adductors. TFL, good. There's a IT band, good. A couple more on the lateral side. What abducts your hip?
Gluteus medius.
Yeah, glute med and minimus. Good. Okay, so glute max is pretty easy to find. That's basically your bum cheeks. Piriformis is deeper, And usually people will be tight in their piriformis or the other external rotator muscles. So if you just kind of feel through their glutes, and you feel deeper, you'll feel like a tight band. That's often their piriformis. So it kind of starts on their sacrum and it comes out here to their greater trochanter. So you just feel through here. Again, you're going to have to apply more pressure here than you would with doing the glute max. That's how you kind of differentiate between them on how hard you're pushing. Okay, so that's piriformis. Anything else I should check while she's on her? I guess I already showed you hamstrings. Anything else while she's on her stomach?
You said you mentioned you can feel the greater trochanter.
Oh yeah, I'll show you that. So if you bend her knee, find where about you think her greater trochanter would be, and then move her hip into internal external rotation, and you can feel it sort of move under your fingers. That's how you know that you're on it. Okay, so hers is right here. Good. Okay, anything else? Then you can roll over onto your back. So TFL comes off of the ASIS. It's basically the size of your pinky, and it goes laterally and inferiorly, so like this. That's where your TFL is. And most people, when you find it, if you're ever rolling out your hips with like a softball or a lacrosse ball or something, you can easily find this spot because it all of a sudden becomes super tender. Okay, next time you're rolling out, give it a try, and that's how you know you're on your TFL. Once you do that once, you'll never forget where your TFL is again. So right here. It's often rope-like too, so easy to find. Okay, and then that comes down and becomes your IT band. I already showed you how to do IT band along the lateral side. Rectus femoris, I kind of showed you when we did knee, but again, remember it's right below the ASIS, so you can feel that tendon there, and then you can feel all the way down. And then iliopsoas is more medial, so if you find where her ASIS is and come medial to it, that's her iliopsoas muscle, all along here. And oftentimes people will be tight in there. They'll feel hard. Okay? So that's iliopsoas. Adductors I showed you already, along the inside of the thigh. Be careful when you're palpating, especially if you're doing someone from the other gender. You don't want to get too close. Make sure you're telling them, explaining to them what you're doing. You're talking to them the whole time. I think that's it. Did I miss anything? Oh, glute med and min. So that's on the lateral side. This is your iliac crest. Inferior to your iliac crest is where you'll find glute med and min. And they're hard to differentiate between the two because they're kind of one on top of each other, so you just palpate them at the same time. Right here. I'm going to show you on this side. So this is your iliac crest right here, inferior from it. In here. Okay, any questions about the hip? Okay, then I guess we're moving on to